What is nasogastric tube feeding? Nasogastric feeding is needed when a person cannot eat or take medications by mouth. A narrow plastic tube is inserted through the nose to deliver milk or oral nutritional supplements and medications to the stomach. The length of time the tube needs to remain in the care recipient varies according to their health condition. To prepare for nasogastric tube feeding, you will need the following items. A bowl for warming milk. Milk feed as prescribed by your doctor. A cup. A measuring jug. A teaspoon and sieve. A 50 ml syringe. A measuring tape. A pH indicator strip. And alcohol swabs or wipes. Please refer to the video on how to prepare milk feeds and medications for more information. Now, let us proceed with preparing your care recipient for feeding. If your care recipient requires repositioning, diaper change or suctioning, which is a procedure that removes phlegm, please perform it before the feeding. First, wash your hands with soap and dry them thoroughly. Next, inform your care recipient that it is time for feeding. Make sure they are sitting upright. You may use a pillow behind their back for support. Before feeding, you will need to check that the tube is properly positioned in the stomach. To check the position of the tube, 1. Make sure the tube is secured to the nose by a plaster. Check that the marking tape on the tube is located outside the nostril. 2. Gently open your care recipient's mouth and check that the tube is not coiled or twisted inside. 3. Use a measuring tape to measure the length of the external tube from the tip of the nostril to the bottom feeding port. This measurement should be within a 2 cm range of the original insertion length. If the measurement of the external tube is more or less than 2 cm from the original insertion length, please do not feed. Contact your community healthcare provider for advice. Lastly, check the internal tube placement, which is done by checking the pH of the withdrawn stomach fluid. To do so, wipe the tip of the syringe and the feeding pot. Bend the tube before opening the feeding pot to prevent air from entering into the stomach. Connect the syringe to the feeding pot. Release the band. Pull the syringe plunger to withdraw stomach fluid until resistance is felt. Once you are done withdrawing all the stomach fluid, bend the feeding tube and remove the syringe. Recap the feeding pot. Use the syringe to extract out some stomach fluid onto the pH indicator strip. Ensure the 4 colored zones of the pH strip comes in contact with the fluid. When the color of the pH strip has stopped changing, compare the color changes against the color chart on the pH indicator container. Only proceed with feeding if the pH reading falls between 0 to 5. For pH strips with markings in 0.5 increments, it is acceptable to feed if the pH falls within the range of 0 to 5.5. You will also need to check the color of the stomach fluid withdrawn. If it appears like coffee grounds, do not feed. If you are unable to obtain any stomach fluid to be used for pH testing, please refer to the troubleshooting video of common nasogastric tube feeding issues. If you are unsure, seek help from your community healthcare provider. You will also need to check the volume of the stomach fluid withdrawn. This will determine if the milk feeds given earlier have been digested. Please refer to the troubleshooting video of common nasogastric tube feeding issues for more information. Now, let us start with the feeding. First, wash your hands with soap and dry them thoroughly. Remove the plunger from the syringe. Wipe the tip of the barrel and the feeding pot. Bend the tube and uncap the feeding pot. Connect the barrel of the syringe to the tube, while keeping the tube bent. Pour the milk into the syringe. Release the tube band and allow the milk to flow slowly into the tube. Hold the syringe at the level of your care recipient's forehead to control the flow of feeds. Bend the tube while filling the syringe with milk feeds. This is to prevent excessive air from entering, which may cause stomach discomfort. Observe your care recipient closely while feeding. Stop feeding if you notice any signs of aspiration such as persistent coughing or shortness of breath. Once the milk feeding is complete, flush the tube with water as scheduled to prevent tube blockage. If your care recipient has prescribed medications, proceed to administer them through the tube. You can refer to the related video on how to administer medications for your care recipient. It is important to keep your care recipient in an upright position for at least half an hour after feeding, to minimize the risk of stomach content regurgitation. If your care recipient has persistent abdominal discomfort or distension, diarrhea, vomiting or difficulty in breathing, please seek medical advice. After feeding, remember to wash your hands and the items used. You should keep all items clean and dry until the next feeding. Thank you for watching this video.